Hello and Assalamu alaikum everyone. This is Mariam Abdul Wahid, Executive Lead at Student Interest Group Neurology, Down Medical College Chapter. I'm really excited to share with you all a new initiative of Life in Neurology by our chapter, something that is really different for what we have discussed before. We have had many sessions or many occasions where we have talked about what the whole process of match is like and what it takes to match in your dream specialty of neurology. But something that is not often talked about is what happens when you have finally matched into your dream specialty. How does your life change when you become a resident and how your day to day looks like? So, I guess what's better than directly hearing it from someone who has been through it all. So, I'm really excited to have with us today Dr. Syed Mustafa Shah, who is currently the Chief Resident at University Hospital MU Healthcare. So, Dr. Shah, before we begin our discussion about your training and life in neurology, I think it is most appropriate to take a step back and start with the very first question that comes into mind. What do you think made you choose neurology at all?
That's a great question. And thank you so much, Mariam, and the entire team at Sign for having me on this interview series and getting to learn about life as a neurology resident. For me, the way I break it down, my interest in going into neurology, I think it started with as a medical student thinking about what I really enjoyed studying and what I had a natural curiosity for. And for me, that area was definitely neurology, learning about the brain, about psychology, and even reading things Snell's anatomy. It was very tiring sometimes, but it was always interesting. So it started with my theoretical interest in the subject area that kind of pushed me towards getting more clinical experiences within neurology, particularly working in the neurology department at civil hospital and then doing neurology rotations abroad. And then I got to see the clinical side of neurology, especially the people and the patients and the way it's practiced. And that showed me that neurology is one of those fields where there is definitely a lot of logic and critical thinking. There's also a lot of humanism, empathy, and care for patients because a lot of the things that are in neurology are the conditions, you may not be able to cure them, but there's a lot of emphasis on supporting the patient, rehabilitating them, and just being there for them. And that means a lot to patients. I really like that combination of critical thinking and humanism. And then I kind of delved more into neurology, into the career paths, the way it's practiced, and the diverse branches of neurology. And this is something that everyone can look up online. You can check the American Academy of Neurology website. The cool thing is that in neurology, you can practice in a wide variety of settings. So you could work in the ICU as a neurocritical care physician. You could work in an outpatient setting as a movement disorder specialist, an epileptologist, a neuromuscular physician, or even a general neurologist. And if you prefer to be not seeing patients, you could be doing EEGs, nerve conduction studies, electromyography, and be learning about this area of neurophysiology. So there's a lot happening in neurology clinically. It's growing in terms of research output and even in terms of policymaking, administration, education is a very thriving field. All of that really sold me onto neurology. And I think the last thing that was the main factor that kind of like made it go from 90 to 100% certainty was the fact that the people I met in neurology, people in Pakistan and abroad, they were all very much the kind of people that I enjoyed being with. And I could see myself wanting to have a future similar to theirs and being in their group and their community. And I think that's very important whenever you choose a medical specialty because that group of people will be your community in your home. And really found that feeling within neurology.
Thank you so much, Dr. Shah. Especially the last point, I think your first answer kind of reflects how much diverse this whole field is and how many different aspects there are. So, let's moving on to the residency. So now that you have been part of your program for so many years, from what I've gathered is that the program itself differs so much from state to state. It kind of feels like that these programs itself have a personality which is different from every different hospital. So if I were to ask you or anyone were to ask you about your spec program, what do you think is the best thing about it and anything unique that you'd like to share with us?
Really, yeah. Um, it's always worth considering what kind of program you want to fit into. And I feel people don't appreciate that. The applicants, obviously, you want to match period, but you also want to be in the right program where you'll be happy. And even IMGs, they have that opportunity. So for me, the thing that I liked about my program and why I chose my program, what I think is the best thing about my program is basically the culture, the residents that in my program, people I knew who have graduated, the people I'm currently working with, and even the juniors that have come after me, they've all been part of the same culture of being very caring, supportive, understanding, down to earth, and very easy people to work with. And that makes a massive difference because neurology residency, it is very hard and busy. It's, I would say, more difficult at times than internal medicine and family medicine, pediatrics, because there are fewer residents on busy services like stroke service. So there are times when you're working long hours and you're in the hospital seeing a lot of complicated patients. And just knowing that the people around you, they're there to support you and they're your friends, you can have fun with them, you can chill with them, that makes a big difference. And it makes the hard days a lot more bearable and even days you can look forward to. Whereas if the people that you're working with, if they're not good people that you want to spend time with, even a very not busy day can be a very unpleasant experience. So I would say the main thing that really drew me to this program that I really liked was the culture, the people, and the leadership, and the support that they give residents.
Right, that's great to hear. Okay, so moving on, starting residency as a doctor is itself a huge thing. And when we consider IMG specifically, it's actually a completely different thing to move from city to city as compared to someone who's changing countries for starting a new job. So, so obviously, starting residency as a doctor is like a huge adjustment for anyone anywhere. So, if we were to ask you if there's anything you wish you had known before starting residency, or you'd like to give any tip to anyone who's has recently started residency or plans to start, what that one thing will be.
Hmm. I feel like there's a lot of things. I guess one area would be for everyone starting residency, be it in neurology or other areas, kind of having a good idea of what kind of work-life balance you want. So it's very easy to be in residency and forget about, your health or your well-being or your hobbies or your friends. And the issue with that is, you get burnt out, you get low energy, your mood gets worse, and it's hard to perform at work as well. And it's not very sustainable. So if it was me looking back, I would kind of think about what do I want to do for my health? What do I want to do for my social circle? What do I want to do for my hobbies? What do I want to do for my well-being? And kind of incorporate that so that you're as refreshed, as recharged, and the best version of yourself overall going into work. I think that's an important area. Another thing that I would say is important is connecting with people and having your own circle and your group so that if you've had a hard day, you know who to go to vent, if you know who your mentors are to ask them for advice or input. And that makes a massive difference because then you're not in the dark anymore. And then I'd say a big part of it, especially for IMGs, is being very proactive and seeking feedback because you're new to the system, you're new to the culture, and you're new to the workflows as well. So no matter how smart you are, you will always be kind of behind the learning curve. And the most important thing is to be very proactive in seeking feedback. Ask every person you work with, your co-residents, other healthcare workers, nurses, your physician assistants, attendings, um, program directors, everyone, what you can do better and how you can grow. And whatever feedback they give, incorporate that. And then kind of focus on little things like going the extra mile, supporting your friends, taking an interest in people, and kind of smiling and being friendly with all the people you work with so that they're happy to work with you.
I think your answer has already built up to what we wanted to ask you further. So I guess as you have already mentioned, how much the community plays a role in the life of someone who has started a residency in somewhere totally new. So, stepping back, stepping away from a hospital for a moment, let's discuss a little about life outside work. So, if I were to ask you, what is the best thing about living in your city, or if you'd like to share anything specific about it, what it's like in living as a neurology resident in Missouri?
Right. So I'm in a city called Columbia, in Missouri. It's a college town, a medium-sized city, I think population of 200,000. And coming from Karachi, which is huge, one of the largest cities and most populated cities in the world, it's a big change. And initially it was like, there's obviously less going on, it's less busy. A lot of things closed by 10 o'clock. So it's kind of one of those things that I also had to adjust to. But one thing that I'd say that I really like about this is that being in a medium-sized city, you kind of feel comfortable, you kind of feel familiar. As a resident, you have like a limited amount of time to kind of explore. But having a smaller city that's medium-sized, where you have the basic things like enough of a community, enough, like in the way of shopping and entertainment, enough in the way of like activities like culture, parks, hiking. You meet that criteria of things you want to do, and at the same time it's the cost of living is a lot lower. So my cost of living would be maybe even half of what it would be if I was in a big city like New York. Um, and for a resident that makes a big difference. And the other thing is, in a small city, the other thing that I really liked in Colombia was that being a medium-sized city, people are more friendly and more welcoming. It's kind of like easier to connect. People aren't always in a rush. And I really like that in the culture. It makes a lot easier and less stressful outside of work. And it makes it a lot safer as well. So I feel like that combination of being a medium-sized city, having the things I wanted from that city, um, being safe, low cost of living, and having a very friendly community made it a really good place for me to start.
That's really great to hear. So, before we wrap up, one last question will be, what is the one piece of advice that you'd like to give to all those who are planning to apply to neurology, or like all neurology applicants for their future?
I think that's a very important question. I feel like the first part of that question is thinking about the applicant and what they want and why they want to do neurology, because that's where it starts. Um, they have to think about why they want to do neurology, what they want out of this field. Is there some other field that they could get that same dream or ambition or goal out of or not? And then, that's the reason about starting why you want to do it. That affects, how you would write your personal statement. That affects how you would convey your passion or interest in your interviews and how sincerely and deeply you can convey it. And that'll also affect your motivation to do all of the things that you need to build a strong CV, you know, your step exams, your clinical experiences, your research, your networking. If neurology is something that you kind of want to do, but like it's kind of a backup, but it's kind of something that's also interesting, you won't be able to go as far as someone who's just trying to do neurology. So I would say, get exposure to neurology, do clinical experiences. Pakistan, in Pakistan, you can work in the neurology wards or departments in whichever hospital you're in. I think civil has a good department and we see a lot of patients. Talking to attendings, talking to mentors makes a big difference. There are lots of opportunities for research in neurology. And I feel like the more you do to build your interest and your passion, whether it's clinical experiences, research, networking, it would kind of tell you if this is the right fit. And you're also building your CV at the same time. Um, I think that would be the where I would start. And then the next step, once you've decided neurology is your goal, a lot of the things you would do for neurology are similar to other specialties, like your USMLEs, your clinical rotations, your research, and building your CV. I feel like networking plays a big role because then you learn about opportunities to kind of develop and show your interest in neurology outside of the standard things, whether that's research, whether that's projects, quality improvement, or like medical writing. Um, and people can kind of guide you through that process. So having an open mind and just following your passions, as simple as it sounds, does make a big difference.
Thank you so much for explaining this all in so much detail and for sharing all your experiences and insights. I have really enjoyed this conversation, and I think we all have gained a better understanding of what it's like to be a neurologist. So I guess that will be all for our episode. We'll be bringing more insights from more neurologists all across the world.